If you're sick,
if your child is in pain or is feeling miserable, paracetamol is a medicine that can help them feel better, but giving too much can be a bit dangerous. My name is Giovanna and I'm a nurse, and I'm going to be sharing some helpful tips on how to use paracetamol safely. Paracetamol can be given to children and babies over 3 months old, but if your baby is under 3 months, take them to the doctor first before giving them paracetamol. It can be given if your child needs pain relief for an ear infection or a headache, or if they're feeling miserable, but it doesn't need to be given if they have a mild fever. Fever is your body's way of fighting an infection, and just a fever alone doesn't need to be treated. And if your child is getting a vaccination, you don't need to give them paracetamol just in case they feel miserable. Wait and see if they need it first. Don't give your child paracetamol for more than 2 days without seeking medical advice. But if your child has been really unwell and you're concerned, ring or take them in to see the doctor. Paracetamol is available as a liquid or tablets. The liquid form is commonly known as Pamol. It's available in 2 strengths, 120 milligrams and 250 milligrams. Before giving, check that the amount you have is the correct dose for the strength of paracetamol that you have. Paracetamol is found in other medicines you may have bought in the chemist, so make sure you know what is in each one so you don't risk accidentally doubling up. The medicine in the bottle tends to settle at the bottom, so before opening, mix it well by turning it over and back a few times. Measure your paracetamol using an oral syringe or a measuring cup. Just don't use the spoon as it might give you the wrong amount. The right dose depends on the strength of paracetamol you are using and your child's weight. So before using the paracetamol, you need to know your child's weight. Then check the dosing table or follow the instructions on the prescription bottle. Keep a record of how much paracetamol you give your child and the time that you've given it. As your child grows, the dose of paracetamol will be increased based on your child's weight. So be sure that you are giving the correct dose. Don't give more than 4 doses of paracetamol within a 24-hour period. And wait at least 4 hours between each dose. And if someone else is caring for your child, make sure you know what other medicines they've had and the time that they were given. Keep all medicines out of sight and reach of the children, ideally in a locked cupboard. Paracetamol doesn't need to be kept chilled, so you don't need to keep it in the fridge where children can easily get it. Also, check that it has a child-resistant cap. Ask your pharmacist about this. When your child is sick, encourage them to rest or play quietly. Make sure that they are warm but not too hot. Encourage them to drink small sips of water regularly. Used correctly, paracetamol is a safe and useful medicine to help your child feel better, but too much of this can damage your child's liver. So if there's any chance that your child has had too much paracetamol, call your doctor or your nurse or the poison center immediately.
For more information about how much paracetamol to give your child, go to healthify.nz/paracetamol for children, or use the Healthify paracetamol dose calculator.